Suppose you see an established office patient with stable hypertension and dyslipidemia. Blood pressure is perfectly controlled, and LDL is 88. You make no changes in medications and schedule a follow-up visit in 6 months. How much is this encounter worth? Here's the note. It contains 37 words. To figure out what it's worth, we need to figure out the level of care by taking apart the history, the exam, and the medical decision-making, and plugging that information into this table, which shows the documentation requirements for established office patients. For these encounters, only 2 out of 3 key components are needed. You can use either the 95 or the 97 rules. In this case, the 95 rules work out best for the doctor, so those are the ones we'll use. Starting with the history, here's the table we use to figure out what level of history has been recorded. Here we have a valid chief complaint, and then the statement, patient feels fine. This contains absolutely no elements of HPI, PFSH, or review of systems, and so is completely invisible from an E&M coding standpoint, and would qualify for no level of history. The next step is to check the physical exam. Looking at the exam and using the 1995 E&M guidelines, we see we have recorded information about the constitutional system, the respiratory system, and the cardiovascular system. This gives us 3 organ systems, which means in all likelihood this would qualify as an EPF physical exam. The next step is to check the medical decision-making. Taking apart the medical decision-making, first thing to do is look at the problem points. Here we have 2 stable problems, which means each of them is worth 1 point. This gives us 2 problem points. The next step is to check the data points. Looking at the data points, here all we did was look at the labs, so we only get 1 data point. The next step is to check the risk. Looking at the risk, here we have 2 stable chronic illnesses, which by definition means that this encounter would qualify as being of moderate risk. So we have 2 problem points, 1 data point, and moderate risk, which means that since only 2 out of 3 dimensions are needed, this adds up to low complexity medical decision-making, so the final key component is now known. Going back to our documentation grid, now we know we have no recorded history, an EPF exam, and low complexity medical decision-making. Remember, only 2 out of 3 key components are needed for these encounters, which means this adds up to a level 3 established office patient, otherwise known as the 99213 level of care. Putting it all together, here's our note. Remember, only 2 out of 3 key components are needed. Here we have a non-qualifying history, a qualifying physical exam, and qualifying medical decision-making. Here, the 99213 level of care took us 37 words to complete and is worth $68.97, which adds up to a whopping $1.86 per word, which is excellent documentation efficiency. I've said it before and I'll say it again. For a level 3 established office patient, it doesn't take much to complete the documentation. Thanks for watching. If you want to learn how to take apart a note like this, consider signing up for one of our web-based E&M coding curriculums. We offer several different subscription options to match any practice pattern. We also have a coder curriculum, which includes up to 33 AAPC CEUs for only $99. If you need E&M coding education for multiple providers, ask about an E&M compliance web portal, which provides trackable and verifiable E&M coding education for multiple doctors.